Tuberculosis remains Papua New Guinea's biggest infectious disease killer and reason for admission to hospitals. In 2008, the statistics reveal that 6,357 people were infected with TB. Since then, the statistics have risen rapidly. In 2024 alone, the statistics rose to 46,000 people infected with the disease. This situation in the country highlights the urgent need for continued efforts to address the TB epidemic, including improving treatment adherence, expanding the access to care, and addressing the challenges of drug-resistant TB.
To end TB in Papua New Guinea and to also end and reduce HIV/AIDS in our country. Yes, we can. Yes, we can.
The Health Minister Elias Kaparove has declared war on the disease.
46,000 people at the moment infected with TB in the country. Toklo, there are 126 people who are infected with TB every day. That's about nine people dying. I will not dwell on this kind of statistics anymore. I'm not going to talk about this anymore. It's time for action. Today we're going to identify practical actions. So next time when I attend the assembly, Western Pacific region or World Health Assembly, I will not be repeating this kind of statistics again. I will talk about what we have done and this how we have improved. That's my position. In our statistics, we know where we are. We know what's happening. 9 to 40 people dying every day. That's serious enough. This is a crisis. We must acknowledge World Bank. They supported us with $15 million. $15 million. How much money? How much is that? 60 million. This is serious stuff. This is a crisis. Nearly about 90% of our country is in red. Tamlo Tok I'm finished today. 9 to 14 people dying of TB every day in our country is not a simple thing to think about. It's serious enough. And this is serious enough. 46,000. In 2008, there was only 6,000. 2008, people look on the slide here. Just went up like this. 2008, only 6,000. Last year, 46,000. That's crazy. So Department of Health, are we sleeping? Public health team, were we aware that this was going up? Were we aware of the statistics? 2 years now, you look also went up. You were supposed to have an intervention in place. Advise everybody, come together, let's fight this. You know, Larim go 46,000 now. You know about people dying every day, 9 to 14. I want from the statistics today, as there was a clear strategy way forward, and let me know, I need to present this to our government and get that funding that's needed to start next year. Not waiting until 2035, but every 6 months reporting.
The PNG National Tuberculosis Summit 2025 is scheduled for the 12th to the 14th of August in the nation's capital, Port Moresby. The theme for this summit is Eliminate TB in PNG, Strengthening Cooperation and Innovation.
I now take this particular responsibility and the opportunity to now declare the PNG TB Summit 2025. Together, we must join this fight and make this difference to reduce TB in our country.
The Tuberculosis Caucus, along with the National Department of Health, will ensure this summit will drive an impact in this fight.
This launching is not just an ordinary launching of a summit, but it's really part of us galvanizing all our effort and all our stakeholders to come together and start a movement that starts from the national level. Not just the minister only. It's just a minister, one man. Many times he will have a hard time, trying to make the case to the NEC or to the treasurer or to a finance minister. And the resources, Prime Minister has to balance it out with all the needs of our country, education, security, infrastructure. Some get used for get allocated for good purpose. Sometimes too, other things happen that we misappropriate or misapply, or all those things goes on. So we cannot just leave it with the minister. We have to do all we can in order to overcome this crisis that we face, which, as I said, should not be happening. TB is a preventable, dying of TB is a preventable death, and we can overcome it. What we need is a movement which is led at the highest level of advocacy, right down to all our communities, galvanizing everybody to come into the equation, and we challenge ourselves that not 10 years, not 5 years, but maybe in 2 years, we can turn it around. And we must challenge ourselves. Today, I want to call on all of us to challenge ourselves. Because it took only how many years? 2008 to 2025 now. Took only the few years for the statistics to go high. We can absolutely reverse it. As the chair of the PNG TB caucus, I want to strongly affirm our caucus commitment to providing the leadership and working with the minister and all your stakeholders to come up with the strategy, and for us to do the advocacy at the parliamentary level, on the floor of parliament, in the committees, and also at the provincial and district level to get real action going.
Tuberculosis must be treated like a pandemic. The neglect in ensuring people infected with this disease be treated has been lacking, and the government, the National Department of Health, and all involved in this are working towards eliminating TB in 2035.
While the call is on all of us to sort of get together and put money and do all these things, I think the biggest call and the biggest action needs to come from the national government. You guys need to put your money where your mouth is. And they've got to demonstrate that through you as the minister. And we've got to fight this thing head on. And the important thing is, how do you want to get these results? Is, Acting Secretary Ken and his team going to run around the whole country and get these results? Or are you going to get these results through the PHAs? If you're going to get the results through the PHAs, then you've got to push money down to the PHAs. You have to. The national government needs to trust the PHAs. It needs to trust the provincial governments, and then push the funding down and hold us all accountable for delivering the results that our people need. The response in different places is not going to be the same. Every province is different. In every province, there are good partnerships on the ground, great people on the ground, and all the national government has to do is to tap into that enormous talent pool, and I'm sure we can beat this.
According to World Vision, Papua New Guinea has one of the highest prevalence rates of tuberculosis in the world, second to the Western Pacific region, with over 30,000 new cases reported every year. With world statistics, World Health Organization has revealed about a quarter of the global population is estimated to have been infected with TB bacteria. About 5 to 10% of people infected with TB will eventually get symptoms and develop TB disease. WHO also explains tuberculosis as an infectious disease caused by bacteria that most often affects the lungs. It spreads through the air when people with TB cough, sneeze, or spit. Despite all this, we all know by now tuberculosis is preventable and curable.
As long as you must be symptoms and